Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, let me introduce. We are from Group 12, Grade 2A, Nursing Faculty, Andalas University. This presentation, we will discuss about stroke. We are from Group 12. We want to introduce our group members. We consist of 4 people. They are Aulya Meisa, Mitra Miftahul Jannah, Mutia Fajarra, and Siti Maharani. First, definition of stroke. Stroke is a condition that occurs when the blood supply to the brain is reduced. Without blood, brain not get oxygen and nutrients, so the cell in the brain will die soon.
Okay, thank you, Mutia. Next, cause of stroke. There are 2 main causes of stroke. 1. A blocked artery or ischemic stroke. 2. Leaking or bursting of a blood vessels or hemorrhagic stroke. Okay, 1. Ischemic stroke. This is the most common type of stroke. It happens when the brain's blood vessels become narrowed or blocked, causing severely reduced blood flow or ischemia. A blocked or narrowed blood vessels are caused by fatty deposits that build up in blood vessels or by blood clots or other debris that travel through your bloodstream and lodge in the blood vessels in your brain. Okay, next, hemorrhagic stroke. Hemorrhagic stroke occurs when blood vessels in your brain leaks or ruptures. Brain hemorrhage can result from many conditions that affect your blood vessels. Factors related to hemorrhagic stroke include 1. Uncontrolled high blood pressure, 2. Overtreatment with blood thinners or anticoagulants, or 3. Blockage at weak spots in your blood vessels walls, or aneurysms. Over trauma such as a car accident or by protein deposits in blood vessels wall that lead to weakness in the blood vessels. 6. Ischemic stroke leading to hemorrhage. A less common cause of bleeding in the brain is the rupture of an abnormal branch of thin-walled blood vessels or arteriovenous malformation. Okay, next, the signs and symptoms will be explained by my partner, Mitra. Okay, Mitra, time is yours.
Okay, next, sign and the symptom. Let's make the sign and the symptom easy by making an acronym. You can spell B fast. Okay, first B. B is for balance. Does the person have a sudden loss of balance? Patients who have had a stroke have the potential to experience problems with walking, balance, and body coordination. If you suddenly lose your balance while walking with a severe headache and loss of coordination, it may be a symptom of a stroke. Okay, A is for eye. Has the person lost vision in one or both eyes? Stroke not only occur in the brain but can also occur in the eyes. Medically, an eye stroke is known as a retina artery graft. This condition occurs due to a block in the blood vessel in the retina and can be triggered by various things. F is for face. Does the person's face look uneven? One of the most visible signs of a stroke is that half of the face is paralyzed so that it looks tilted. In addition to tilting, half of the face is also numb. This happens because the nerves in charge of supplying oxygen to the facial muscles are damaged. A is for arm. Is one arm hanging down? Unable to lift one arm due to weakness or numbness. Not only the arm, the leg on the one side of the arm also experience weakness. S is for speech. Is the person's speech slurred? Does the person have trouble speaking or seem confused? Stroke often make communication difficult. This is because several parts of the brain work simultaneously to allow us to speak and understand speech. Stroke that damage this important part cause speech disorders. T. T is for time. Call 911. The most appropriate treatment for stroke is to call an ambulance as soon as possible. Stroke is a time-dependent medical emergency. The more time was, the greater the risk of brain damage to the patient.
And the next, I am Siti Maharani will explain about treatment of stroke, which consists of non-medical treatment and medical treatment. Treatment of stroke. A. Non-medical treatment is simple physiotherapy exercise. There are several training techniques or approaches from the physiotherapy sites, Bobet concept, MRP, PNF, brainstorm, and so on, but the point is sensory stimulation, improvement of postural muscles, and direction to correct movement patterns. B. Medical treatment. Ischemic stroke treatment. 1. RTPA injection. Recommending tissue plasminogen activator. 2. Antiplatelet. 3. Anticoagulant. 4. Antihypertensive. 5. Statins. 6. Carotid endarterectomy. 7. Annuloplasty. Hemorrhagic stroke treatment. 1. Medication. Drugs to lower pressure in the brain, lower blood pressure, and prevent seizures. 2. Operation. Prevention of stroke. A. Primary prevention. Primary prevention of stroke includes efforts to improve lifestyle and overcome various risk factors. Primary prevention can be done with lifestyle modification, which include 1. Low salt diet. 2. Physical activity. 3. Doing regular exercise. 4. Maintain weight. 5. Avoid drinking alcohol and drugs abuse. 6. Set a healthy diet. Secondary prevention. This is done through treatment of risk factors. This is done through drug therapy to treat underlying diseases such as heart disease, diabetes, hypertension with drugs such as antihypertensive drugs.
The last, prevention of stroke. 1. Primary prevention. Primary prevention includes our improved lifestyle and overcome various risk factors. There are include low salt diet, physical activity, maintain weight, and set a healthy diet. 2. Secondary prevention. Disease done through drug therapy is to treat underlying disease such as heart disease and diabetes. That's all from Group 12. Thank you so much for your attention. Assalamualaikum warahmatullahi wabarakatuh.